As senior laparoscopic surgeons, sometimes we face very interesting or baffling case scenarios. I want to share one such case with you today, where it was very challenging, and you can say that it was like it took a lot of planning to execute that surgery, and we are really happy with the outcome. I am Dr. Praveen Koduru, Senior Consultant Laparoscopic and Laser Surgeon at Sree Nandaka Laparoscopy and Laser Hospital. Recently, a 55-year-old female presented in my OPD with a huge hernia defect. So what is a hernia? Hernia is basically a defect in the abdominal wall, in the muscles, through which there is protrusion of abdominal contents. So that lady has undergone 3 previous hernia surgery repairs, all of which have failed, and she has given up. And with that hernia, she was living for last 20 years. So the hernia slowly grew in size, attained enormous proportion, and when she presented in my OPD, she was literally holding her abdominal wall, entire abdomen in her hand. She was carrying the hernia in her hands. So as a preoperative workup, we did a CT abdomen, and we found that our entire abdominal contents, our intestines, everything is inside the hernia sac. She has nothing inside her abdomen. Now that is the dilemma. When we replace all these contents into the abdomen and close the hernial defect, she is going to land in severe abdominal compartment syndrome, because we are trying to fit in too much content into a very small narrow space. So we did a thorough workup of the patient, optimized her, asked her to do some respiratory exercises and all. Then with a multidisciplinary approach, we started pre-operative optimization of the patient. So which included, as a part of the plan, initially we first gave Botox injection into the lateral abdominal muscles to paralyze the abdominal muscles, so that when we try to close the defect, the muscles don't try to pull laterally, and usually they help us to bring the abdominal wall together. So after proceeding with Botox injection into these muscles, we waited for a month for the muscles to totally lose their you can say contractile strength, become flaccid, and after that we took the patient for something called Preoperative pneumoperitoneum, PPP. So this is a procedure where we fill the patient's abdomen with room air, which is almost like 1 liter of air every day, so that the patient slowly gets accustomed to an increasing volume inside the abdomen. So this usually, how it helps in the surgery is, now that the patient is getting used to some volume inside the abdomen, when you do the surgery and place all the abdominal content back, the patient's abdomen will accept all the content back. So the preoperative pneumoperitoneum was continued for 10 days, and after that the patient was taken for surgery, and we could do the procedure with minimum you can say complications. Patient recovered very well. We could close the abdomen without any abdominal compartment syndrome, and now we have a really happy patient thanking us that for the first time in her life she could have a proper surgery done, and she can now attend all the marriage functions. She can go around without any social stigma, and happy patients, when we see the patients are happy, it gives us a lot of happiness that we are of some use to the society. Thank you.